Human immunodeficiency virus, or HIV, is a virus that attacks the immune system, which interferes with the body's ability to fight off illness and infection. If this virus is not treated, it will develop into the life-threatening and chronic acquired immune deficiency syndrome, or AIDS, which is the final stage of HIV. This autoimmune disease is most notably spread through having unprotected sex, but it can also be spread by using dirty or used needles, blood transfusions, or from mother to child by pregnancy, childbirth, or breastfeeding. Before HIV spread throughout America during the 1980s, causing tons of trouble, it was not heard of before. It is believed to originate in Kinshasa in the Democratic Republic of Congo around the 1920s from chimpanzees. The first cases of AIDS weren't actually called AIDS yet. They were in 1981, where 5 young previously healthy gay men were found with a rare lung infection called PCP. Later that year, in December, PCP was reported in people who injected drugs by needle. It wasn't until September of 1982 that the CDC used the term AIDS for the first time, and HIV was discovered as the cause of AIDS in 1984. While HIV and AIDS were discovered in the United States during the 1980s, the deadly disease had its peak in the 1990s. In 1992, AIDS became the number one cause of death for men aged 25 to 44 years old in America, and by 1994, AIDS became the leading cause of death for all Americans aged 25 to 44. In 1997, the Joint United Nations Program on HIV and AIDS had estimated that 30 million children and adults had HIV worldwide and had 16,000 new cases every day that year. The minority groups that suffered the most during the epidemic were African Americans, being 45.6%, and gay or bisexual men being 67% of the affected Americans during the 90s. After learning that AIDS had a 40% survival rate and that HIV spreads through the body within 2 to 12 weeks unnoticed, the risk factors for the disease were taken more seriously. A person would put themselves at risk of HIV if they had unprotected sex or would often use IV drugs. During the acute phase of HIV, the symptoms were very flu-like, such as night sweats, cough, fever, headaches, weight loss, diarrhea, muscle aches, joint pains, rashes, sore throat, and painful mouth sores. During the chronic phase of HIV, which can last multiple years, the symptoms include fever, swollen lymph nodes, fatigue, oral yeast infection called thrush, weight loss, diarrhea, shingles, and pneumonia. At this stage, the HIV has reached the white blood cells and is now on the progression to AIDS. The symptoms of the body developing AIDS are sweat, chills, chronic diarrhea, swollen lymph glands, weight loss, unexplained fatigue, weakness, skin rashes or bumps, and persistent white spots or unusual lesions on your tongue or in your mouth. In order to prevent these symptoms, the best thing to do is to always use condoms during sex, use clean needles, and always treat others' blood like it is infected. Although HIV is not curable, it can be kept at bay and prevented from turning into AIDS by drugs. The first drug to treat HIV was AZT in March of 1987, which was approved years later for children in 1990. In 1995, the FDA approved the highly active antiretroviral treatment, or HAART. HAART brought the decline of between 60 and 80% of HIV being the main source of medication to patients. Some important people that helped during the HIV and AIDS epidemic with their discoveries were Luc Montagnier, who identified HIV at the Pasteur Institute in Paris, and Robert Gallo, who proved that HIV was the cause of AIDS in 1984. Currently, HIV is still active in America, with approximately 1.2 million people still living with it. Advancements in medicine have taken place to make HIV undetectable, but there still is no cure.